Our next speaker is going to be Dr. Rachel Sturke. Dr. Sturke currently serves as the Deputy Director and Senior Scientist in the Division of International Science Policy Planning and Evaluation at the Center for Global Health Studies at the Fogarty International Center at NIH. In this role, she oversees a portfolio of global implementation science projects and program evaluation portfolio for Fogarty. Dr. Sturke's work in implementation science includes a focus on building research capacity in implementation science in low and middle income countries and using innovative platforms to bring implementation scientists together with decision makers and program implementers from LMICs. And Dr. Sturke has worked extensively in many of those highlighted countries, including India, Ecuador, Peru, and Sub-Saharan Africa. She will also be presenting virtually today, so I will turn it over to you. It looks like you have control of your slides. Awesome.
Thank you. Thanks very much for that kind introduction. Yeah, so I'm going to be talking about funding for implementation science for global health. I'm going to sort of try to stay a little bit away from the NIH opportunities because Gila just went over them. So I'm going to try to provide sort of the contours of other opportunities that are for funding that are out there for implementation science. I did want to just present like a little bit of context to start. Our previous director, Dr. Roger Glass, and then Dr. Peter Kilmarks came out with a paper in 2021. And just to say they were outlining opportunities in global health. And one of the areas they highlighted, you can see at the bottom, is implementation research, which I think has gained traction in the recent years, as Gila did mention. Certainly in the global space has become something that folks are very interested in, and I think it's quite needed. I wanted to just highlight again just some sort of broad concepts around funding for implementation science. This schematic is from an Essence best practice document. And Essence is a group of funders that focus on global health research capacity building. And this was a document that they developed around funding for implementation science in low and middle income countries. And there's a lot of what's here is very intuitive, but just to say, this was a result of a collaborative and collective perspective from a number of high-level funders, including NIH, Wellcome Trust, WHO. So just to say, they're all valuing these dimensions of and characteristics and necessities for funding implementation science, including stakeholder engagement, embracing diversity, enabling the implementation research practice to evolve, the power of partnerships, and then really thinking about how to embed implementation science into health systems. So really making the connections between the research and those that use the research in health systems, including program implementers and policymakers. This is just a little bit more detail from the same document, but just to say they all engage in different types of partnerships to enhance their funding opportunities. And I think, again, as Gila mentioned, this happens across the NIH, where the different institutes and centers collaborate to move the field forward. This is also happening across funding platforms where it's possible. Sometimes it's complicated given that we're all sort of these large administrative bodies, but there's a push to try and coordinate and leverage each other's investments, which I think is critical for implementation science and will help, again, move the field forward. This is just context. Gila sort of put this out there in a different way, but just to say, NIH is made up of 27 institutes and centers. I wanted to point out that I sit in Fogarty, which is the very smallest center at NIH, but we are the only center that's congressionally mandated to focus on global health. There are large global health portfolios at other institutes and centers as well, and that has grown over the last probably decade hugely, but we leverage partnership across NIH to extend the reach of our investments. I wanted to talk briefly about Fogarty only because some of our funding opportunities are focused on capacity building specifically, and I think these funding opportunities are unique in terms of helping develop the pipeline of independent scientists. So Fogarty's mission is really to address global health challenges through innovation and collaborative programs for research and training. I think notably, Fogarty is known and for our investments in capacity building. So more than half of what we put out in funding is for training of research scientists usually in low and middle income countries. And really our mission is to support and advance the NIH mission through global partnerships. So again, all of our work is focused on research across a diversity of global health challenges and diseases, but all in low and middle income countries. I just wanted to talk a little bit about what it takes to build the next generation or the research workforce. This is true across global health research in general, but it applies as well to implementation science. So really, we think about this endeavor as spanning from developing well-trained individuals who have protected time to conduct research, and where there's really a critical mass. That's sort of our aim, is to create within different disciplines in global health a critical mass of researchers where there's enough people and numbers to develop strong collaborations and also find mentors. That is something that in the implementation science space in low and middle income countries, we are beginning to see capacity that enables mentorship, but often people are sort of in a desert of capacity. And so again, we're working to try to develop that capacity. Fogarty has trained more than 6,000 scientists worldwide, and we support over 400 research and training projects at over 100 academic institutions. And like I said, we don't focus on one disease area. That's sort of a unique to Fogarty. We focus on issues spanning from infectious diseases to informatics to brain disorders. Again, usually developing programs that address an unmet need in the global health research space. So these are just training opportunities that are worth taking note of if you are someone or know someone who wants to develop a career in global health research. One of our signature programs is the Global Health Fellows and Scholars program, and this is open to students and postdocs from the US or from LMICs. And who apply to a consortium of universities and are placed in a low and middle income country research site to do a 12-month research project. And we have lots of alumni who have gone on to stay in global health after these awards. And they're open again to many different disease areas, so including implementation science. We also have a KO1, which is a 5-year mentored support for postdoc for US research scientists, and then a fairly new K43, which is sort of mirrors the KO1, but is for LMIC research scientists. So I wanted to talk a little bit about the Global Alliance for Chronic Diseases, for whom my colleague Brad Newsom is the Fogarty point of contact for this program. And basically, the Global Alliance is focused on implementation science on NCDs, and it includes participation from 11 different institutes and centers across the NIH, but is a consortium of funders who are focused primarily on implementation science, but as applied to chronic diseases. So the 2022 call, I should say, was focused on prevention, NCD prevention in adolescent, young adults, and other vulnerable stages across the life's course. So the basics of the GACD are that it's, again, focused on NCDs and LMICs and vulnerable populations in high-income countries. It's anchored on a focus on implementation science. The funders mutually agree upon funding topics and execute a coordinated competition, and then follow through with joint and individual peer review models, which again is one of the quirky, challenging issues with funders coming together to do a joint call. GACD has an annual scientific network meeting, and then also has associated implementation science workshops, as well as an implementation science school that they hold every year, and now that's virtual. So here you can see there's the, this is the second annual Implementation Science Research Training School. So those used to be in person. And again, they've moved to an online platform. And then there's an implementation science workshop that's a little bit less of a deep dive that co-occurs within the context of the annual meeting. The idea really with GACD is to create a global community of practice, which I think they have done successfully. And this includes researchers, so investigators, also policy experts and funders. And really the enabling force of the community of practice is these diverse perspectives that they're able to leverage. They focus on a multi-country approach, which theoretically might increase generalizability of findings, or certainly enables a cross-learning platform where researchers and research teams can learn from each other. The Secretariat is responsive to investigator needs, and really the evolution of the funding is sort of a grassroots effort that is led by the consortium of funders. And they have a really robust set of working groups that identify emerging issues and then sort of publish collaboratively. So they're able to disseminate learning from this model quite well. The upcoming funding opportunity. So this past year's funding opportunity was focused on city environments. And increasingly GACD is moving away from disease-specific funding opportunities to more cross-cutting funding opportunities. So that's been an interesting evolution, and I think an important one in the context of implementation science. So I just wanted to share very briefly, I think one of the challenges, I think, in the field of implementation science is that if you are a new investigator to implementation science or a new investigator to global health, it sometimes is challenging to receive or successfully apply to an NIH grant. And so there are other grants that are smaller and one could see as a bit of a stepping stone to receiving an NIH grant. So here you can see there are PEPFAR related small grants. There are grants from the Bill and Melinda Gates Foundation, from USAID, and from the CDC. One that I wanted to just point out, the International AIDS Society here, the CIPHER Collaborative Initiative for Pediatric HIV Education and Research provides grants for implementation science projects. And I have seen several of my early career colleagues who are part of some of the work that Fogarty has done successfully compete for these smaller CIPHER grants and then move on to successfully compete for an NIH grant. And then UNAIDS and Wellcome Trust also have small grants. I did want to list here, this again was sort of covered by Gila, but there are many grants across the NIH that are increasingly focusing on implementation science beyond the general trans NIH DNI call. AHRQ also funds small grants as well as PCORI. And then I just wanted to put up here, Fogarty curates a page on our website that that is well visited, so has some traction, that where we share implementation science news, resources, and funding for global health researchers. So this would be a good place to visit if you're looking for funding opportunities for global health and implementation science. Again, this is just how one might connect with Fogarty. And then I just wanted to put up, just this here is where you can subscribe to our newsletter. So with that, I will turn it over to the next speaker, and thank you very much.